Hey Dragon Slayers. Today's video is Dr. Barry's message to doctors, part 7. Don't forget to like and subscribe because it really helps the channel out. Let's get started. So his advice to older doctors, so this is any doctor who's been doing it for 15 years or longer. You have had some degree of success in your medical practice. Over the years, you have come to feel that you can handle anything a patient might bring you. Usually, after just a few words from a patient, you already know their diagnosis and what treatment they need. However, you then have to sit politely and let them finish their story before you can talk about their diagnosis and treatment plan. You have to remind yourself that sometimes hoofbeats are from a zebra because you know how rare zebras are. This is a very dangerous time in your practice for you and your patients. If your career as a student is over, then your career as a doctor should be over as well. The reason Dr. Barry loves the M numbering system is that it reminds him that he is still a student. As he wrote this book, at the time of writing this book, he was an M21. He is still learning not just details, but whole new paradigms concerning medicine, nutrition, and health. Reading and rereading are just as important for you now, he's addressing his dear colleagues, as they were when you were a lowly M1. If you know everything there is to know, or even if you think you know all you need to know, you are a danger to every patient you treat. It is so easy to become complacent, lazy, jaded, bored, and burned out that you can't bring yourself to question long-held truths and newly published ones. Well, tough. You choose to wear a title that means teacher, and you can't be a good teacher if you don't continue to be a good student. That doesn't just mean keeping up with the latest guidelines from your governing body. It means questioning both the old basics and the new guidelines. Most patients believe the longer a doctor practices, the better they get. However, you and Dr. Barry both know that isn't necessarily true. Only when a doctor continues to read, study, and think can that be true. The minute you stop having to read, both in your specialty and outside of it, is the moment you start becoming less of a doctor. Neither your patients nor your nurse will necessarily see any signs of your stagnation or deterioration. But you and Dr. Barry both know it's true. Doctors have no real way of receiving meaningful social or peer feedback, and this can make it hard to stay on the proper path. It's easy for a seasoned doctor to bluff, pontificate, and just misconstrue in a way that makes them seem very impressive to all who hear. It doesn't mean that they know or remember a darn thing. There is often so many politics in medicine that being right can get you in trouble because the right idea seems so radical or goes against the current standard of practice. Please don't be part of this problem. Step away from that dark side and be part of the solution. Dr. Barry respectfully included several suggestions for you, the seasoned and respected doctor. Keep reading. If macular degeneration steals your vision, then learn Braille. Doing your reading is a requirement at any level of medicine, no matter your age or career status. Books and journals will occupy much of your time if you're doing things properly. The doctor who is nearing retirement owes it to his patients to keep reading up until the last day, knowing the guidelines but don't blindly follow them. Dr. Barry bets that 200 years ago, the American Association of Leech Medicine published guidelines on all the uses of leeches in medicine. Every doctor had a copy of these guidelines and followed them faithfully. If a doctor strayed from these peer-reviewed guidelines, they would be considered they would basically be censored or chastised by the powers that be. Does that example sound ridiculous to you? Well, let's change the variables a little. Let's change the name of the association and the name of the treatment. The American Heart Association published guidelines on the use of statins in medicine. Every doctor had a copy of these guidelines and followed them faithfully. If a doctor strayed from these peer-reviewed guidelines, he would be censored or chastised by the powers that be. Same story, different players. The problem is that both of these treatments, leeches and statins, were ill-conceived and continue to be the standard of care long after it was clear that their use was completely foolish. They both offered little benefit to the average patient and were fraught with dangerous side effects. The lesson here is to stay up to date with the guidelines, but don't follow them blindly. The statin fiasco didn't have to last decades. It could have been killed quickly if doctors had been kept examining the research and asking millions of questions. Millions of patients have suffered and billions of dollars have been spent on a class of drugs that effectively did nothing positive for the average patient. This should get you thinking, what else are you prescribing that is ill-advised? Always be thinking and exploring the literature. Your patients love and trust you. You owe it to them to be right most of the time. Dr. Berry has always thought of his patients as his children. Although some patients frown on this outlook, it helps him and the way his mind works to have this perspective, but it also holds him to a very high standard. For example, the American Heart Association says that the newest big pharmaceutical pill will lower the risk of something. But when you read the actual research, it's obvious that the right people at the FDA were treated to the right lunches, and that special treatment affected the outcome of the recommendation. So what should you do? If you don't hold your patient in a special place in your heart, even the difficult patients, then you might say, hey, who am I to question the big dogs? I'm just a small town doc trying to get by. This rationalization might seem justified to you. However, it is one of the most shameful things of your position you could ever perform. Yes, you're between a rock and a hard place. Yes, there might be ramifications if you don't follow the guidelines. So what will you do? Thinking of his patients as his children makes it easy for him to tell the regulatory agencies to stick their guidelines up there you know what. Well, Dr. Berry wouldn't say that it makes it easy to not give his patient a pill fraught with side effects just because the big dog said that he should, but it makes it so much easier knowing that he's on the right side of things. He wouldn't do that to one of his children, and he wouldn't do it to one of his patients either. His message to his dear colleagues is to read, think, teach, and heal. Be part of the renaissance of modern medicine, not part of its demise. And that's what I've got for you guys today. Don't forget to like and subscribe because it really helps the channel out. And remember, guys, that together, you and I will slay the dreaded diabetes dragon.